if you could just tell us that why is it important to investigate fevers, number one, and if you can include some of the statistics, because I know that every time you always share those statistics in the doctor
Correct.
group which is there, which
Correct.
is something very unique and interesting about Dr. Jariwala Laboratories. So if you could just tell us about different types of investigation which are necessary for fever,
Right.
and the statistics.
Okay, so Dr. Kaur, I would like to first start with that, lab investigations are not necessary for most of the fevers. Okay. There is a misconception that, if you get a fever, you rush and immediately you start getting testing and, panic around, and that should not happen. We should always look at how the fever is presenting first and foremost. Okay, we need to be examined by a doctor first, and then based on that, we can advise certain tests. For example, in this current season, there is a lot of upper respiratory infection which is going on. Okay, and this is most likely to be the common flu. Now, this type of infection doesn't really need to be investigated, right? We can just go to our referring doctor or referring physician and get the treatment started. Yes, of course, if the fever doesn't subside or the symptoms do not go in the next 2 or 3 days, that is a time probably when you should get investigated and maybe look for your flu panel or something like that, which covers the upper respiratory tract infections. Uh, However, the scenario will be different in the monsoon months when there is a lot of other illnesses going on, like dengue, chikungunya, malaria, leptospira, all these things. So in those months, okay, if you're getting high fever, you're getting chills, okay, it is always advisable to start with the investigations immediately, so that we are able to get a proper diagnosis and then start with the subsequent treatment. So it will depend on the clinical scenario, when the fever is happening, what is the severity of the symptoms you're getting, right? And at the most, then if your consultant feels or your physician feels, then you can go ahead with the lab investigations.
Correct. So the process has to be followed, that you go to your doctor first. Don't simply straight away go to the laboratory.
Correct.
And then do it. Otherwise, there will be too many unnecessary investigations.
Absolutely.
And we not be able to even find the cause of fever.
Absolutely. So we need to find a direction in which we need to investigate. It is not that we can just go and do everything blindly. See, because there is no end to doing the laboratory investigations. There is a long battery of tests which a laboratory can do. However, it is always better to speak to somebody before doing them. If your doctor is not available, you can speak to the laboratory also and tell them that so and so are symptoms, and probably they can also suggest you the investigations.
Right.
And then go ahead with it rather than just going and doing a battery of tests unnecessarily.
So, sir, any basic investigation which you can just talk about or tell us? And of course,
Okay.
sorry, before that, any statistics that you have, any interesting findings or statistics that you have?
Yes. So see, interestingly, when we are looking at the statistics, so we generally go through them during the monsoon months, which probably we have shared with you also. So currently at this point of time, when you see that there is a lot of flu again going on, it is usually influenza A or influenza B. Sometimes this can be severe and we need to investigate. So we are getting an occasional swine flu strain also right now. So that happens typically during the winter months. And this year, of course, there's a lot of talk about the human metapneumovirus also, which of course we will discuss later. So that happens typically during the winter months. And in spite of malaria, dengue, and this chikungunya, salmonella, the typhoid, all those being very much endemic in our population, we don't see too much of that during the winter months and during the summer months. In opposition to this, once you start having the later months of the year, June, July, when the monsoon starts, that is the time when you get all this vector-borne illnesses like dengue, chikungunya, malaria, salmonella, leptospira. So that is the time when you see that all these illnesses, they are coming up in a big way. And additionally, at that time also there's a lot of flu which goes on and a lot of swine flu. So this year we had a lot of swine flu in those months also. So you see a trend, a rising trend in all these illnesses during the monsoon months, while in winter it is usually the flu and the other illnesses are not really seen. Maybe an occasional case, that's all.
Sir, have you seen any change in the trend in the past decade or so when it comes to the kind of fevers which come up or the kind of investigation that you pick up in the laboratory?
Right. So there has been a lot of change, I would say. So earlier, what used to happen, once we used to have the rains, these illnesses, monsoon-related illnesses, they used to start towards the end of June. Okay. And they would get over towards the end of September in the Navratri period, when the rains are lesser. But however, this last 5 years, okay, what we've seen is that the onset of the illnesses has shifted. Okay, so instead of June end, the illnesses typically start mid of July, towards the end of July, and they continue till Diwali.
Oh.
Okay, so there has been a shift of onset of these illnesses by almost a month. Now we don't know the reasons for that for sure, but there has been a shift over there. And in addition to that, there have been a lot of new investigations which have come up. Like you, of course, COVID has made PCR very much famous. So there are PCR panels which are available. There's a dengue ELISAs which are available. Chikungunya ELISAs are available. So depending on the day of presentation of the fever, okay, and the duration of the illness, a doctor would advise that, okay, you are in the first 5 days of fever, you have to do the following test. You are in the second week of fever, you have to do the antibody test. So typically in the first few days of fever, what we do is we do the dengue antigen test. For if there is a chikungunya which is suspected, we have to do a chikungunya PCR. If you are suspecting typhoid, the gold standard is a blood culture. Okay, if there is a urinary tract infection, then a urine routine and the urine culture test. Okay, for malaria, of course, we have the thick smear examination, which is the gold standard even today. And if that is not available, we can do a PCR. Okay, so these are done, on the day 1 or 2 of fever, and typically when the fever is very severe. If there are mild symptoms, upper respiratory symptoms, then you can just do a routine CBC and hold on and see how the disease behaves. Okay. And if the fever is persistent and has not been investigated in the first week, then we have the antibody tests which are available in the second week, like the IgM antibody tests which are there. The Vidal is there. Okay, so we can follow up with these tests in the second week.
So, sir, now that is about the change in the trend that has come up. And you also talked about new investigations which have come up.
True.
Has the approach of people, like let's say 10 years ago, 20 years ago, how it used to be about lab investigation,
right,
or the outlook towards lab investigation changed in the last years or so?
Yes, absolutely, very much. Now people earlier used to be very hesitant to do lab investigations. Okay, there were not many investigations available then also. We would always do the routine investigations first. However, now with the progression of the illnesses and the new tests available, people are now more accepting towards blood tests, and there are several occasions where they come and talk to us. Okay, and we advise them the test, and something comes out to be positive. After that, they would go and refer to their family physician, which would save them time. So everybody wants to get investigated faster. Everybody wants to get treated faster. So now people have started, being open to lab investigations, and they are more proactive towards getting it done.
So just a query from the medical point of view.
Yes.
What I have noticed is earlier it used to be that we would wait for 3 to 5 days for the symptoms to maybe become more prominent, for some localization.
Right.
But what we are noticing now is that even then we are not able to identify the cause.
True.
And therefore, whether is it justified to order investigation on the 0 to 24 hours, the first day itself.
Right.
Especially the specialized investigation like malaria and dengue.
Correct.
Is there any logic or flow chart?
So there is no flow chart as such, but I would put it across like in a way that what is the severity of the symptoms that the patient is having. Like when you have the monsoon months, I don't think there is any point of waiting for 2 or 3 days, because it is going to be one of these 4 or 5 illnesses.
Correct.
Okay, so what we do is typically as practitioners, we would be prescribing a CBC. When we are looking at the hemoglobin, we are looking at the white cell count, the platelet count, which is very important, right? And we are looking and trying to identify what kind of infection it is. It is just a plain viral, or if there is a drop in platelet count, maybe dengue, right? Something like that. Or if there is a drop in the WBC count, maybe your typhoid fever. Okay, so we are looking at the CBC report, and along with that, we are also ordering a CRP, okay, or an ESR to see if the CRP is elevated, how high the ESR is, and probably trying and judge if the cause is again bacterial or viral. Okay. In addition to this, now the trend is that the 4 main investigations, okay, which are available. So like malaria, okay, so MP has to be done along with the CBC, right? You have to do chikungunya if there is a joint pain, a chikungunya PCR.
Correct.
Okay, a dengue antigen, as I mentioned earlier. Urine routine to look for urinary tract infection if there is a burning urination or burning micturition, right? And in addition to that, we also look at the general parameters, like you would like to have one enzyme from the liver, like SGPT, to see if there is any damage to the liver happening. Okay, you would like to know baseline status of your kidneys with the creatinine test. So these are the few first line investigations which you would like to do depending on what season this fever is happening in. Now, if the patient presents with only fever, okay, and all of these are not a positive, or you're not able to find anything in this, then probably the next line of action would be a chest X-ray to look for a lower respiratory tract infection or a pneumonia. Okay. Again, if there's going to be an upper respiratory tract infection, I don't think there's any need to investigate unless you have a very high fever.
True.
So, this is how it usually goes in the first week of fevers.
So now what I understand, and I hope we are able to convey this to people, that every investigation has a reason behind it. It's not that we just simply write a list of investigation and there is said why so many investigations for fever. But then there is a logic behind it.
Absolutely. And see, you need to investigate more now because there are quite a few of these illnesses which have an overlapping symptomatic pattern. All of them will prevent with fevers. Okay, you will have rigors or chills in dengue, but the same you can have in urinary tract infection also. You can have those in your chikungunya also, right? And body ache again is a constant. Most of the fevers they present with body ache. So, it becomes very difficult sometimes clinically also to differentiate between this. Okay, and that is the time you will need to add on to more tests in order to save time and reach an early diagnosis.
Right, sir. And on that body ache thing, I just realized many a time patient used to come to us and ask us that you did chikungunya in the beginning, it did not come positive. Now after 1 month, again you are asking for chikungunya. Now that test is coming positive. It's a very common question.
Common question.
Patient will ask. So if you could just put some light on that.
Right. So see, what happens is that, as I explained earlier, okay, there is for an early diagnosis, the tests are different. Okay, like in the first 5 days, if you're looking at chikungunya and you're giving a prescription of chikungunya IgM, that test is not going to come positive. It takes at least 7 to 10 days for the IgM antibodies to appear. So during this phase, you should be doing a PCR. Okay. So typically this is a standard thing and standard query which we also face. That I had 4 or 5 days of fever, I had done this chikungunya test. Okay, it came negative, and after again a month, it is still the symptoms are still there, and it is coming positive. So then we have to explain it to the patient that in the first 4 or 5 days, the chikungunya IgM antibodies will not be positive, because ultimately it is the body's immune response which is getting developed to against chikungunya, and that is what we are picking up with the IgM antibodies. So instead, a PCR has to be done. The same thing is with dengue also. So in early stages of dengue, you have to do a dengue antigen test. Okay, if you do a dengue IgM or a dengue IgG, that is not going to be useful. So which test to be done at what point of time is also important in order to reach a diagnosis. And IgM antibodies are not to be done in the first week of illness.
Okay, this is interesting and quite useful. So tell us in the comments if you have found something which has satisfied your queries that you have had so many for such a long time about fevers and investigations.
True.